And this is, to my mind, kind of the most important slide of the kind of data part of the thing. Again, when I was contemplating joining Lief as the chief medical officer, I really want to see what is this thing and is it really helpful? And so again, I like meta-analyses, and I found a number of large meta-analyses, one for anxiety, one for depression in particular here, and wanted to compare the effectiveness of this treatment. Many of you may be familiar with effect sizes, which is essentially in scientific literature, we have is something significant, and then we also are interested in the effect size, which is, as it sounds, how big is the effect of an intervention on an outcome. And effect sizes for medication in anxiety tend to run in the 0.3 to 0.6 range. Higher is better, CBT 0.2 to 0.7. And it turns out, again, this is quite a large meta-analysis, dozens of studies that shows the effect size for heart rate variability biofeedback is actually comparable to that for medication and for CBT. Same for depression. It's a poorly kept secret that medications like SSRIs are only modestly beneficial for depression. Cognitive behavioral therapy is fairly good, although it's a very person and labor intensive modality. And HRV biofeedback turns out to be also quite effective in the treatment of depression. So this for me was, when I was contemplating joining Lief, the real startling thing, like, wow, this really is a valuable therapeutic modality. Oh dear. There we are. So we also, Lief did their own small trial as well. This is an 8-week open label study for anxiety, and we had significant drops in anxiety scores using PHQ-2 for anxiety. I'm just going to quickly touch over this, but HRV has a number of potential application in HRV biofeedback. HRV biofeedback has been shown to be helpful in anxiety in people with pregnancy, in children, and also in children with autism and adults with autism. It's shown to have benefit in addiction cravings, for cognitive function, typo, insomnia as a fitness tracker, and also it's a marker for cardiovascular risk, particularly in people post-MI, as well as in how well managed your diabetes is. Thinking of you, Harsh. What is HRV biofeedback? So HRV biofeedback is the intervention to improve HRV, to increase HRV. And it's essentially a breathing technique, and this is kind of a tech-enabled or enhanced breathing technique. But what HRV biofeedback does is it's breathing exercises that syncs your heart rate with your respiration and tries to exercise the parasympathetic nervous system or the vagus nerve. What we do is it's this 2-lead ECG patch, as illustrated, that connects via Bluetooth to a smartphone. And this is a screenshot of the smartphone app. And what you see when you do an exercise is it's tracking your breathing and your heart rate and your HRV. And it essentially instructs you through haptic feedback to breathe out and then breathe in. And then when it catches that your HRV is starting to drop, you breathe out again. And you do an exercise anywhere typically from 2 to 5 minutes, several times a day. And so the app is guiding you through the exercise for the HRV biofeedback. This is just a screenshot of how a downtime dose works, what your phone might look like. And there's 2 ways to really use the Lief. One is scheduled, what we call downtime doses, scheduled biofeedback exercises. The other one is something called an auto dose. And this is particularly unique for Lief. And because it's an actual ECG, as opposed to PPG, the light-based things such as the Apple Watch or a Ring, it's able to detect and analyze your HRV in real time. And it can detect when you're feeling stressed. It notices when your HRV drops and can trigger you with a little buzz and say, hey, your HRV dropped, it looks like you're being stressed. Do you want to do a little exercise right now? So one thing unique about Lief is it can capture you in real time when you're feeling stressed, both interrupt that, but also then that's a good moment to practice increasing your parasympathetic tone and to increase your HRV. This is just a reminder me to mention that Lief is actually a clinic, and we have Lief coaches, and you can do coach or no coach programs, but we found significantly better results when someone's using a coach. The coach is available for texting, and also typically every 2-week, 20-minute coaching sessions. These aren't really therapy sessions. These are sessions where they help kind of check in, see what the obstacles are to using Lief, making sure you're optimizing how to use it best to get the best results. A coach typically does an onboarding session where they show you how to use it. It's 30 minutes. Then they build a personalized plan. They're available for chat support, weekly tracking, and then again, the bi-monthly coaching sessions, which are typically over video, but they could be via phone as well. Quick, many of you are probably thinking about other things in this space. The most sort of high profile are Apple Watch, which can sort of track HRV, or a Ring as well. And HeartMath is a thing that you clip onto your ear. Some differences are that we're the only actual ECG in the market, so we're the only ones capable of doing real-time HRV analysis that you can also wear around at the same time, as opposed to the others where there's much more considerable amount of noise involved and not able to do this kind of instantaneous analysis.